got everyone here and everyone seated, sort of, more or less. I blamed Glenn earlier this morning. I said, Glenn, didn't have enough seating? But this is a good problem to have when we have more than we expected. My name is Tom Allen. I'm chairman of the Anderson County Council, and my heavy duties here this morning is to welcome everyone here and basically turn it over to the gentleman who's going to explain all of this to you, Mr. John Miller. So, John, have at it.
Thank you, Tom, for that glowing introduction. I want to thank all of you for being here. This is a small and friendly group, so I'll try to make this as brief as I can. How many of you know how many people each year die in our country from sudden cardiac arrest?
Too many.
One, even if it was one, that would be too many. But the number is 460,000 people a year. And so today we're here to present an AED, or an automated external defibrillator, a couple of them, in fact, that AnMed Health has earned. It's a life-saving device for someone who goes into cardiac arrest. And as AnMed Health System is very much involved in trying to improve the quality of life of the people that live in Anderson County. But this program is a part of Health Safe 180, which is a program of St. Jude Medical Incorporated. They have a cardiac arrest outreach program, and we were eager to be involved. And through Heart Safe 180, hospitals like us receive free AEDs that can be donated to be placed in key places in the community. And in 2012, we were fortunate enough to earn 2 of these units, and we think that we're going to get another one before it's all over with. And people choosing to use local physicians and local healthcare facilities is how we earned these particular devices. So while AnMed Health is very proud to be making this donation and placing these AEDs, it's been a collaborative effort. It's not just us. It's been very many people involved. We've worked with the Heart and Stroke Safe Community Initiative to identify high-traffic public areas like the ones that we're in today, and Meals on Wheels and the Social Population Recreation Facility, which we're in, were the ones that were selected. And many older folks and young folks with pre-existing medical conditions are served by these organizations, and we're proud to be a part of placing these devices here today. The collaboration didn't end there. A young man by the name of Jordan Breitenberg, who's sitting right over here, conspicuously dressed in his Boy Scout uniform, has agreed to be involved in training the people that we're going to be using these devices. And of course, Anderson County has agreed to take care of the maintenance and the installation of these devices. So it has been a very collaborative effort. So now, you know, all I know about this, and I've read this script poorly, but I want to ask Dr. Manfredi, Joseph Manfredi, to come up. He is the expert. He is with a arrhythmia specialist at AnMed Health. He can tell you a little bit about sudden cardiac arrest and everything you need to know about AEDs.
Good morning. Good morning. Just to elaborate a little bit on that number that Mr. Miller quoted you, with 460,000 people dying in the United States each year from sudden cardiac death. Put that in a different perspective, it occurs approximately 1 in every 80 seconds. So it's a very significant problem. The data shows that 95% of these people who have sudden cardiac death don't survive to make it to the hospital. Now, one of the things we should do first is define what sudden cardiac death is. And sudden cardiac death is defined as a death from a cardiac cause within 1 hour of the onset of symptoms. 90% of these are due to chaotic heart rhythm problems that decrease the blood flow to the brain, which can make people pass out, unfortunately pass on. The treatment is effective, immediate shocking of the heart back into normal rhythm to restore the blood flow to the brain. When this occurs in the community, the risk of death is 95%. When we provide this in the hospital, that is reduced by 50%. So it's imperative that we get to patients when they suffer this kind of an event, immediate effective defibrillation. By placing these defibrillators in the community, I think our hope is that we're going to be able to save more lives each year, and hopefully educating those in the community to how to use them safely and effectively. Any questions? Thank you all for coming. This is a big day.
I think now is the official presentation. I'm not sure who's going to be representing the two organizations. Dr. Manfredi, you can handle the devices, and I'll do the plaques. Let's see. Not sure which one goes which way, but we'll switch it out later. So, thank you. And these are the important things. Don't drop them. And you want to make some comments?
Pass this over and I'll do that. We definitely appreciate at Meals on Wheels all that's been done for us to acquire an AED. Jordan was working on his project, I think, at the same time that the committees were meeting, the collaborative committee was meeting, and so it definitely was something that was meant to be for Meals on Wheels. Although we serve a homebound population, we utilize a lot of volunteers that help us each day, and a tremendous amount of those volunteers are older, so they are at higher risk for problems. Fortunately, we have Susie Merriman, who occasionally is in our office, and it seems that every time something happens, she's there. So, Susie is Jordan's mother, and they knew the need that Meals on Wheels had for a device like this. Fortunately, we've not had to use it. We've not had an incident that severe previously to having it, but we're very fortunate we had it. Not only do we have about 60 volunteers that come into our office every day to pick up meals to go out and deliver, but we do have a few fundraisers throughout the year that there again we have a large population of about 500 people that come to our fundraisers, and a tremendous amount of them are the older population there again. So we feel like this is going to be something that's very worthwhile in our organization. So we thank you.
With special populations, we have a vast majority of special needs individuals, and also in this building we have a lot of seniors. So we've had a couple incidences where we've had to call the ambulance out for these individuals, so having the AED will help in responding to whichever one's needed. So we thank you so much for getting these to us.
I assume these empty boxes where nothing will go. Well, that completes our presentation. Unless you have any more questions of Dr. Manfredi, he's just eager to answer questions. But we appreciate everybody coming out, especially all of our elected officials, and we appreciate all of you participating in this collaborative effort. So, with everything said and done, I hope you all have a healthy day.
Thank you.